Numbness and tingling in your hand, not often descriptors that we like. But once you've been checked out, you've ruled out anything dark and scary, and you're still having it, but you've been left with nothing to do, I want you to give these couple of things a try. All right, so when we have things that we describe as numbness, tingling, weakness, we need to get them evaluated by someone, preferably in person. Now, if that's happened and you're like one of my patients, you have this numbness, tingling that comes and goes, but you're not quite sure what to do about it, I have 3 moves for you to try that I think might be helpful. So the first move we're going to work on is a nerve mobilization for the median nerve. The median nerve controls the first 2 fingers and half of the 3rd finger. Generally, it's going to be on the palmar side is where you feel that numbness and tingling with a relaxed upper body. So you want to make sure that you're not shrugging up through here and you're not grossly rounded forward here. Grossly just means that I can see you doing that, not like icky gross, just so we're clear in our terminology. But you're sitting upright. You're going to extend that hand off to the side with your wrist relaxed here. So it's not doing anything yet. You're going to extend off until you feel a stretch through that arm. And then what you're going to do is tip your palm away, and that should increase the tension, the tingle, the pull down through the hand if this is the nerve that's affected on you. So what we're doing is flossing through this. We bring it to full tension, kind of ouchy, weird tension. We're going to back off on it, break through the elbow, break through the wrist, bring that arm back up, and then we rinse and repeat. We're going to do this at least 15 times. And with each rep, you should feel like it's getting to be less and less tension, less and less painful. And then when you stop, you might even notice less numbness, tingling throughout the hand altogether. Now, for the next one, we're going to be focusing on the ulnar nerve, which generally is going to be your ring and your pinky finger. A lot of people, my gamer types, will experience this. Or if you have anything that kind of puts that wrist as a contact point right here, it's going to be controlled by your lower cervical spine, so the nerves that exit there, that then course down through your chest onto this tricep side of your arm, through this inner elbow and then along the pinky side here. So a lot of people will report numbness, tingling through here. It does not follow through these first 3 fingers. You might have something light. You can definitely combine levels, which is unfortunate, but that's kind of what happens too. The body gets to do whatever it wants to do. And so for this ulnar nerve floss, we're going to do the same thing. So again, it's not a hit and hold stretch. We're flossing in through that nerve and we're working through each of the different pinch points. So how I describe this one is a lot of times you're going to be in a kind of a 90-degree position here. Again, we're not hitched up through this upper trap area. That's one of the hardest things to kind of concentrate on. Then if you were like a waiter and you were carrying a serving tray, is bring that thumb around. So now your fingers are pointing up towards your head. You can bend away and then come back down and out of it, up, here. If that gives you enough tension, that's totally fine. If you need a little something extra, you can bend your head towards, see how that goes for you here. You can bend your head away, but again, we don't want anything stinging or zinging down our arm or making our numbness or tingling that much more intense. Kind of stick with the 15 reps, do whatever feels right to you. If 15 reps feel good, you take a pause, you still feel good, do 15 more and see how that goes. One of the things that I really like to concentrate on is that you are breaking up your day and doing these movements. So it's probably not going to be a one and done type of thing, especially if you're like a computer worker. After 60 to 90 minutes of you working on stuff, just take a couple seconds and kind of work through some of these movements. And then also focusing on through your chest and neck. Stuff is not in isolation. I'm just going to cover the nerve mobilizations on this, but let me know in the comments if you want me to give you a more, I don't know, broad range, full global approach to some of these issues. Okay, then our last one is going to be the radial nerve. This is when people feel it through their whole hand. But the key difference with this is on the first 2, generally people are feeling it through the palmar side. When the radial nerve starts to get affected, it's generally on the back side of the hand. And it also is kind of on like this upper lateral delt, upper arm area as well. To make sure that we're focusing and remembering that the neck is certainly involved. The chest could be involved, the arm can be involved, and down through the wrist can be involved. So then what you're going to do is rotate your arm all the way so that the back of your hand is basically facing the ground. And then you're slowly going to lift straight up. And that should kind of light you up down that entire pathway on the back of the arm. So again, as you guys know, we're going to go for gentle but good tension down the arm. No zinging, no stinging, no sharp stabbing pain. And what you're going to do is lift arm up. If that's enough for you, cool. If not, you can play with your head towards the side. If you need even more than that, you can gently go head tips away. Remember, that's putting your nerve on full stretch. So you want to take that really slow, and full stretch does not necessarily mean better. Again, with this one, more intense does not equal better. We want gentle, and we want to find out what works best for you. So really what you're doing is reevaluating after those 15 reps. Do you feel better? Do you have less tension? Do you feel looser through those areas? If yes, proceed. If no, if it flared you up, stop doing it and refer back to someone in person.